Lung cancer is one of the leading causes of cancer-related deaths worldwide, yet it often goes unnoticed until the later stages. This silent progression makes early detection crucial, which is why understanding the early symptoms can be a game changer, potentially saving lives by prompting earlier intervention. This video breaks down the early warning signs of lung cancer that are easy to overlook but essential to recognize. So, keep watching if you want to learn more. Number 1. Persistent cough. A persistent cough is a common early warning sign of cancer, typically lasting several weeks or more and not improving with standard cold or flu remedies. This type of cough can be particularly alarming if it changes in character or intensity over time. It may manifest as either a dry cough or one that produces sputum, and its defining feature is its stubborn persistence. Unlike temporary coughs caused by respiratory issues, a persistent cough in the context of lung cancer may signal that the tumor is affecting lung function or irritating the airways. Individuals experiencing such a chronic cough should seek medical advice, as timely diagnosis and treatment are critical for better outcomes. Number 2. Coughing up blood. Coughing up blood or hemoptysis is a critical symptom often linked to lung cancer. This condition involves expelling blood or bloody mucus from the lungs or airways, which can vary from small flecks to significant quantities. It usually signifies damage to the lung tissues, potentially from a tumor invading the bronchial tubes or adjacent blood vessels. The presence of blood in a cough should always be treated as a medical emergency, as it can indicate advanced disease or serious complications. Prompt medical evaluation is essential to diagnose the underlying cause and to begin appropriate treatment if lung cancer is suspected. Number 3. Night sweats. Night sweats are intense episodes of sweating during sleep that can significantly disrupt sleep quality and lead to substantial discomfort. In the context of lung cancer, these are not merely due to an overly warm environment, but are often a systemic reaction possibly linked to the cancer's effects on the body. The mechanism behind night sweats may involve the body's attempt to fight the cancer through immune responses, or could be caused by hormonal changes induced by the tumor. When accompanied by other symptoms of cancer, night sweats should be reported to a healthcare provider, as they may indicate the disease's progression and necessitate further medical examination. Number 4. Chest pain. Chest pain in individuals with lung cancer can manifest as a persistent, unsettling discomfort that may intensify during activities like breathing deeply, coughing, or laughing. This symptom typically arises when a tumor grows large enough to press against the chest wall, nerves, or other structures in the chest, causing pain. The location and severity of the pain can vary depending on the tumor's position and size. Persistent chest pain, especially when it occurs without an obvious cause or in conjunction with other symptoms of lung cancer, is a significant red flag. It is crucial for individuals experiencing such pain to seek immediate medical evaluation to determine its cause and to discuss potential treatment options. Number 5. Hoarseness. Hoarseness is an alteration in the voice that can be an early indicator of lung cancer, characterized by a raspy, weaker, or strained sound. This symptom occurs when a lung tumor presses on or invades the recurrent laryngeal nerve, which is responsible for controlling the vocal cord. The resulting nerve impairment can lead to partial or complete paralysis of the vocal cords, significantly affecting voice quality. Persistent hoarseness, especially when it occurs without typical causes such as a respiratory infection, warrants medical attention. Early assessment and diagnosis are vital, as they can lead to more effective treatment options if lung cancer is the underlying cause. Number 6. Loss of appetite. Loss of appetite is a frequent symptom in patients with lung cancer and can stem from both the physical and physiological effects of the disease. The presence of a tumor can alter the body's normal metabolism, leading to decreased hunger and interest in food. Psychological factors such as stress and anxiety from managing a chronic illness can further reduce the desire to eat. This symptom is particularly concerning when it occurs alongside other indicators of lung cancer, such as weight loss or fatigue. Individuals experiencing a significant and unexplained decrease in appetite should consult a healthcare professional to explore potential causes and receive appropriate treatment. Number 7. Unexplained weight loss. Unexplained weight loss is a critical early symptom of lung cancer characterized by significant weight loss that occurs without changes to diet or exercise routines. This weight loss can be attributed to cancer's metabolic demands, as tumors may consume substantial amounts of the body's energy. Furthermore, cancer cells can alter how the body uses nutrients, reducing appetite and leading to weight loss. When rapid and unexplained weight loss occurs, it's crucial to seek medical evaluation to determine the underlying cause and address it appropriately. Number 8. Shortness of breath. Shortness of breath, or dyspnea, is a common symptom of lung cancer. It typically arises when tumors block or narrow the air passages or when fluid accumulates in the pleural space surrounding the lungs. This symptom can start as a mild inconvenience, only noticeable during exercise, but might escalate to a constant and severe condition affecting even minimal activities or rest. The feeling of being unable to breathe deeply or comfortably can significantly impair an individual's quality of life. Anyone experiencing persistent or worsening shortness of breath should consult with a healthcare provider, as it is crucial for early detection and management of lung cancer or other potential causes. Number 9. Chronic fatigue. Chronic fatigue associated with lung cancer is a profound and relentless tiredness that is not alleviated by rest. This symptom goes beyond normal fatigue and often significantly interferes with daily activities. It may be caused by the cancer itself, which can deplete the body's energy reserves as it diverts resources to support tumor growth. Additionally, the emotional toll of living with a serious illness like cancer can contribute to this fatigue. Persistent, unexplained fatigue is a critical symptom that should not be ignored, as it often indicates the body is under significant stress. Number 10. Recurrent lung infections. Recurrent lung infections are a notable symptom in lung cancer patients characterized by frequent occurrences of conditions like pneumonia or bronchitis. These infections often recur due to obstructions caused by tumors in the airways, which can trap bacteria and impede the lung's ability to clear out infections effectively. Symptoms may include a persistent cough, fever, and an increase in mucus production. When lung infections seem to return despite treatment or linger longer than typical infections, it is crucial to consider lung cancer as a potential underlying cause. Consulting a healthcare provider for persistent or recurrent lung infections is important for early detection and appropriate management of lung cancer. Number 11. New onset wheezing. Wheezing is a whistling sound that occurs during breathing when the airways are narrowed or obstructed. This symptom might arise as air struggles to pass through the restricted airways, which can be due to a tumor pressing on or growing into the air passages. Wheezing is particularly concerning when it appears suddenly in someone who has not previously experienced respiratory issues like asthma. However, it's crucial to differentiate this symptom from those caused by other respiratory conditions. But as you can see, recognizing the early warning signs of lung cancer can be the difference between early intervention and facing a much tougher prognosis. Symptoms such as persistent cough, unexplained weight loss, and chronic fatigue should prompt individuals to seek medical advice, especially if they persist or worsen over time. While these symptoms can be associated with many different conditions, their presence warrants a thorough evaluation to rule out lung cancer, among other potential causes. Prompt attention to these signs not only aids in early detection, but also opens up a broader range of effective treatment options. But real quick, be sure to watch some of our other helpful videos that are popping up on your screen right about now. And just a quick reminder, we are not doctors. This video is for informational purposes only.